health care initiatives. As a member of the Health and Human Services Committee, I have listened to testimony on both sides of the proposal. Joining the two ideas, which are sponsored by members from both sides of the aisle, may seem like a good compromise. But this reminds me of Homer's Trojan horse, the lures of so-called free money, and the possibilities that Nancy and other relevant whistles are tempting. But if we open our gates and accept this package, I anticipate significant surprises. To begin with, enrolling in Medicaid is not without strings. Whether it is the estate recovery program that may recover assets from an estate after an individual dies, or the estimated $800 million in additional spending over the next 10 years, there are strings attached. Mr. Speaker, for a moment, let's set this bill aside and consider our current situation. Maine Care is a program that already serves more than 300,000 Mainers. With a quarter of all Mainers enrolled and consuming 24% of our budget, what does our future look like? The state of Maine has a rapidly aging demographic, and we expect to enroll an estimated 80,000 Mainers over the next 10 years into the Medicaid program. Let me repeat that. Over the next 10 years, without expansion, we will be enrolling 80,000 more into the program. This bill proposes to expand that number by 70,000 to 100,000 people for a total of about 150,000 new enrollees. Therefore, the proposal before us is immense. Someone in this chamber used the word staggering. This is indeed staggering. It is important to remember that the Affordable Care Act is not limited to expanding just the Medicaid program. The title of the bill suggests another option: affordable private health insurance. According to the Kaiser Family Foundation, about 2/3 of the people who are involved in this debate qualify for private insurance through the marketplace. That means that we are really debating about how best to pay for health care services for about 24,000 individuals, not 70,000. So why are we directing 50,000 people to the Medicaid option when affordable private insurance is available with higher reimbursement rates to providers, statistically better outcomes, and a broader selection of doctors? Now let's take a look at the managed care organizations. I agree that managing the care of those who are enrolled in Medicaid is important. But how have other states achieved enough savings for these middlemen managed care organizations to turn a profit? Largely by cutting reimbursement rates, especially to nursing homes. But since Maine's reimbursement rates are very low, where will they find the savings? The chronic underfunding of our nursing homes by about $30 million per year has many of them on the brink of closure already. Maine has explored this option several times in the past, and the cost-benefit analysis just doesn't work. Now consider Commissioner Mayhew with the Department of Health and Human Services' own version of managed care. This pilot program currently involves about 2,000 Medicaid recipients who have been identified as having more frequent patterns of emergency department usage, and by managing their care, we've saved $8 million in 1 year. Given this exciting news, the department plans to expand this program. This and other cost-saving initiatives are already in place. Thus, the introduction of managed care entities with their own additional computer software billing systems is redundant. For these reasons and more, I oppose the pending motion. Thank you, Mr. Speaker.